My name is Kristen Keene, and I am the Residency Director for the Harnett Health PGY1 Pharmacy Practice Residency. Just a little bit of background about Harnett Health. We are a rural teaching community health system located in Harnett County, North Carolina. Harnett Health is made up of Betsy Hospital in Dunn, North Carolina, as well as Central Harnett Hospital in Lillington, North Carolina. Geographically, we are located about 45 minutes from the Triangle area. We are unique in the fact that we are both a community health system and a teaching health system. What that means for our residents is that on all of their clinical rotations, they'll be rounding and participating in interdisciplinary education with medical students, medical residents, attending physicians, and faculty members from Campbell University. We also have a multitude of teaching opportunities for our residents. We are in partnership with the Campbell University College of Pharmacy and Health Sciences. Our residents complete a teaching certificate through Campbell. They're also involved in education of pharmacy students and in their first and third years. They participate in didactic lectures as well as case presentations. Also, since we're located geographically close to Campbell University, there are a number of opportunities for precepting on your varied clinical rotations. Our residency program was started in 2014, and we graduated our first residents in 2015. We are accredited through ASHP, and we currently have 2 PGY1 pharmacy practice positions.
I was attracted to Harnett Health initially for the small community hospital setting, but when looking more into the program, seeing how many learning opportunities there were offered at a small setting, there are a lot of different elective opportunities that you can have as a resident, and all of the staff are very easy to work with, and in every encounter that I had before starting residency, it just felt like a good environment to learn and start my career as a pharmacist.
What attracted me to the Harnett Health Pharmacy Residency Program is the supportive environment both in the pharmacy and out in the facility as well. You get to develop the interprofessional relationships, and they're really pharmacy friendly here at this health system. And then you also have the opportunity to obtain a teaching certificate.
My typical day kind of varies day by day depending on what rotation you're on. For internal medicine, we get there earlier in the mornings to pre-round on all of our patients and look up new admissions that have been admitted overnight to kind of be prepared for rounds with the medical team, which includes several medical residents and medical students, to be able to provide input during rounds. We also go to interdisciplinary rounds midday with other team members like physical therapy, case management, and other disciplines. And then most of the afternoon is spent during consults and other patient care activities like counseling on new DOACs and warfarin.
What a typical day looks like for a Harnett Health pharmacy resident is we'll come in, we'll start working up our patients, go to rounds, and it really depends on what rotation you're on depending on when you go to rounds. We'll go to interprofessional rounds in the early afternoon, and then the afternoons consist of topic discussions or case presentations or project time.
There are several strengths to the Harnett Health Residency program with Campbell. With one being the teaching certificate that is offered through Campbell, it has been a really good experience so far to kind of learn how to make that transition from a student mindset to a preceptor and professor role. It's a really good certificate that I've enjoyed so far, and I've had the opportunity to teach in some classes already. And you can tailor your experience to how involved you're wanting to be in academia in the future. There's always room for more involvement with Campbell, and if you want more teaching opportunities. The atmosphere also at Harnett Health is just a very family-like atmosphere, even though you probably hear that at other programs. This one I feel like is very true, and I felt that from day one of my interview, and ever since I've stepped foot in the hospital. It's just been a really good environment to learn and not be afraid to ask questions. Another good strength of the program is the opportunity to participate on interdisciplinary rounds with multiple disciplines, from medical students, PA students, and medical residents. Getting to form those relationships early on in the program has proved beneficial so far, even though I've only been here for a few months, having conversations with medical residents on a daily basis about patients throughout the day.
Some of the strengths of this program is it's really, the pharmacy is like a big family, and they really accept you in from the very first day, and it's very easy to ask anybody questions, and everybody's very willing to help you learn. Another strength is the variety of rotations that are available. You can really tailor it to what you're interested in, so you could really tailor it to the AmCare side versus really heavily inpatient side or acute critical care emergency medicine.
Please feel free to reach out to me if you have any questions about our residency program or if you would like any further information.